Hey everyone, it's Councilwoman Walla Blagay, and as you know, for this campaign, one of my number one focus under the Walla Blueprint is healthcare. And I have been so passionate about this because at 15 years old, I went to an emergency room and didn't have access to healthcare. I got a $5,000 bill that opened my eyes to our broken healthcare system. And today we're looking at a broken healthcare system. Nearly 3 million Americans have lost coverage of ACA coverage. And I would just add this, 1 in 5 have dropped insurance. So we are at a critical time where we have a system that is not working. And I am here with Dr. Donna Ticknor, who's going to talk about the issues here. We're going to talk about mental health. And the reality is that for mental health, most providers are getting low reimbursement rates. That's why you're not getting access to mental health. That's one of the number one issues. I can say that as a council member, where I'm looking at issues where our students, our kids, our young people, many people in our community are suffering with mental health. And they have limited access to providers that will assist them because of our broken system. Low reimbursement rates, many providers like her have limitations in who they can provide for them. And the reality is that you have to have the right type of health insurance to get access. That is not quality care. You want to talk about it?
Yeah, no, it's been a problem for quite some time, but especially with the cuts that happened the last year, it's becoming more and more unaffordable. Maryland's trying to do their best to be able to cut some of that, minimize some of the cuts, but even with that, we're seeing deductibles go up as much as $10,000 a year, which basically makes the insurance unusable for a lot of folks.
$10,000 a year. Did you hear that? Who is going to pay $10,000 for care? Only a billionaire, maybe a millionaire. But for the average American, mostly 90% of us cannot have access to that type of money. So we have a broken system that is not caring for us. It's time for Medicare for all. It's time for a system that does not require certain reimbursement rates to get access to care. And to be honest, high deductibles. So it's time to change our system. It's time for Medicare for all. It's time for a whole change of our system, universal health care, so that you can get access to care.